Good morning and welcome to Focus on Liberia from FNEFBC State Radio. We're here with the Bong County Representative Moima Briggs-Mensah and a territory of the JFK Hospital, the Disaster Management Agency, and other health workers that have been working since the unfortunate incident occurred in Total Bong County on the 26th of December 2023. We started with Honorable Briggs in this interview. Honorable Briggs, welcome to the press. How are you doing?
Thank you. Sure, you know, we are not doing well, but we bless God. We say thanks for everybody that have been applying their efforts. The situation is serious. It's not like what people think or see on the media, but we all need to get involved. It's a serious thing. We were in Phoebe. We were able to transport a lot of the patients, JFK, 14 Military Hospital, and then Khaled Hospital, ERWA. And I can tell you, when you see these people, it's not easy. Most of the people I'm standing here with, they were here last night because I was here up to 12 o'clock. The nurses, they have not gone home. Everybody's standing, so it's good that we have the disaster management here. And then even the Red Cross people, they helped yesterday. They was in the district, and we were able to bury the brain. People, about 32 person plus. And we're trying to pick up the victims where we have in the communities that sitting home and say they're afraid to come to hospital. And everybody just been helpful. Phoebe Hospital, JFK, ERWA, Khaled, and then 14 Military, the disaster team, the Red Cross team, the county health officer of Bong County, and everybody. I can tell you, even the administrator for the hospital, but everybody was buying gas, fuel with their own money. So we need national government to come in because this is not an individual thing.
This is disastrous, and I spoke with you yesterday. I mean, in a very heavy tone, in tears. He expressed grief over the loss of your citizens. I'm sure you have not slept since the 26th. Tell me, as it stands, what's the number of deaths so far beside the 32 persons that were buried during the mass burial? Do we have any bodies?
So yesterday we have 4. Because we had 2 from Phoebe, and we have 2, one from JFK and one from ERWA. Okay. And this morning we got 3.
From where?
That we're going to take from JFK to take to Bong County.
3 here?
Yes, that's this morning. So we're losing them by the day. Okay. And it's just not easy.
Thank you. Any final call to the colleagues?
I would just say thanks to the health workers, thanks to my colleagues. Senator Moima was there yesterday. Senator Kwe is on his way up for donation. Senator going to do some donation. We just need everybody to come in to see what we can do. Thanks to everybody that have been concerned about this matter, and we pray that we all will get involved to save many lives.
Thank you. And then we go to the head of the Disaster Management Agency of Liberia, Mr. William. Welcome to the press. We just bring the marks down a little bit so they can see your face. Okay. Good morning. How are you doing?
Well, I'm not doing too well because of what I'm just seen. And I seriously want to say that this is a disaster. This is a tragedy. And right now, according to my duty, and I want to call on the government to, through an advisory note to the president, to declare this situation a national disaster. It is very, very serious. If we are not strong, you will not see the victims. You will not see the victims. They are in need of so many items that need to be supplied immediately. I want to thank the health workers. We are right now at the JFK Medical Center, and what they are doing is extraordinary. And they are running out of materials and drugs to treat the victims. So this is very serious. We need items, medicines, food items, etc. Right now, the Disaster Management Agency is trying to get some quantity of rice to Tututa, because you know in terms of this, people are affected and they need to support even family members. Even some of the victims that are in total now, they need support. So we are calling on partners, not only the government, but we are calling on the private sector. We are calling on the UN. We have some partners that have been with us, like the Abijade supermarket, like Simenko, even Metal Steel have started, but we need more. And let me say this is general. There are some supplies that you will give, you're supposed to give to the entities that are the right entities. For instance, medications need to go to the hospitals. We don't need no third party or something. For disaster, we can get items that we can distribute to victims, etc. So let us get this clear. We need these items. The JFK hospital, what I just saw, they are running out of medicine. They are running out of medicine. And if they are not supplied, more deaths will occur. And this is very serious. And I'm sure it is happening in all of the health centers.
So, I mean, your team arrived on the scene of the incident. What can you tell the public, and then what could be the advice so that we can prevent the reoccurrence of things like those? What did you see there? What was established?
Well, really, what was established, one is ignorancy, but that was also played by poverty, because people went there to get something maybe for their living. But we want to advise that anytime such happens, the public should keep off. And even officials like the police, they should be well geared and they should know certain limits before they can, because if you see what is happening now with the officers that were affected, they are greatly affected. I think they have first degree burns or third degree, or third degree is the highest. They have third degree burns, and that can easily lead to death. I mean, it's serious. So even the officers, the security, they need to be trained in how to handle such situation. And the public, we need constant education now to be given to the public that these are dangerous areas. Do not go there. Do not go there. So we need serious education for the public, and we need serious education for even the officials that will be trying to contain. Containment, there are so many aspects. You cannot contain, so all that needs to be learned.
Thank you. Finally, I also take leave of you, even though you have called on the government to declare this a national disaster. I mean, to declare a national disaster. But others were also talking about calling for days of mourning for those who have died across the country. What do you make of that?
Yeah, but this is inclusive.
Okay, great.
When you declare a state of national disaster, then you can determine that, either a week mourning, etc.
Thank you so much. Your name again?
Henry O. Williams, Executive Director, Disaster Management Agency.
So, the authority of the JFK, we are with us, Mrs. Kofa. She is also here to represent the John F. Kennedy Medical Center here in Single. Welcome to the press, madam. How are you doing?
Thank you for being here, and welcome to the John F. Kennedy Medical Center. My name is Dama Rita Yekasin Kofa. I'm the Deputy CEO for Administration here at John F. Kennedy Medical Center. And on behalf of my boss, Dr. Jerry Brown, we want to welcome you to the JFK.
Yes, so bring us up to speed. I'm sure you've been overwhelmed since yesterday.
Day before yesterday.
Day before yesterday. So tell us how is it like here, and how much person have you received, and how things going with you?
So just as a summary, and I think you've been hearing this since our interview here yesterday as well, we received a total of 29 patients, 3 of whom have expired. So we currently have 26 patients here in the facility with a variety of different degrees of burns, which I will have our consultant doctor explain more in detail to you. But the situation here at JFK right now is a very dire one, as is at all of the other facilities across Monrovia. We have patients at ELWA, at Catholic Hospital, at 14 Military, okay? And all of these patients are in dire need of certain supplies. Right now, the major need of the hospital is supplies for these patients.
Just as
When you look at what the patients need based on what they sustain, the burns they sustain, one of the major things we need is fluids. Okay, you need to resuscitate patients when they have burns because they don't have the integrity of the skin anymore. So they're having loss of fluids, okay? And because of this, they can become very intravascularly dehydrated, meaning the fluid in their veins can dry up. So it's very critical to their prognosis, how they do tomorrow, how we respond today. So we need fluids, and one of the major fluids we need right now is lactated ringers, or what they call LR or RL, depending on which pharmacy you go to. So that is one of the major needs. We also need saline solution. We need as much as we can get. Another critical need is gauze and Silverdane ointment. These are the two major things we need right now for the dressing changes. If you were to go in there and see these patients, they have burns from the top of their head to the bottom of their feet, all in their private areas, under their armpits. They are losing fluids. So we usually will clean them. Initially when they come, all of that dead skin has to be removed, okay? And then you have to dress those wounds so that you can prevent infection, which is their biggest enemy right now. Because they don't have the barrier of the skin, infection is one of the first, it's the major cause of death in these patients, secondary or pretty much on par with multi-organ failure. And that's what we are seeing with all of our patients right now. So the ones that are here, we want to make sure we keep them alive, okay? And we need, as much as possible, antibiotics. We're using ceftriaxone, we're using metronidazole, what you call Flagyl, okay? We need those antibiotics as well. We need adult diapers for them.
how urgent are these calls?
They are critically needed. We needed them yesterday.
As of now.
As of now, as of last night, as of tomorrow, in the next maybe few weeks. I heard someone asking a question, how quickly can they heal? Burns don't heal quickly, okay? The very nature, if you see how fire affects even structures, it completely destroys cells and tissue and all of these different, things in the body. So it doesn't heal quickly and it doesn't heal well most of the time.
And what are the dangers if those supplies needed do not come?
The bottom line is we could lose patients. We could lose more patients. And even with the supplies, it's unfortunate to say we may still lose patients. And that's why our doctors and our clinicians, our cleaners, and I also want to state just how essential our cleaners are to this equation. You want to make sure the environment that these patients are in is as sterile as can be, as clean as possible. Because like I mentioned, when they don't have the skin barrier, okay, your skin is the one thing that keeps you from getting infection and exposure to many things out here. So when you don't have the integrity of that skin, you are at risk of infection. And for them, they are at even, exponential risk for infection because that infection could pretty much make them lose their lives.
Finally,
How many male and females are in the clinical room?
Yesterday, they brought only one female. The remaining patients were all male.
and that one female still here?
Only one female, yes.
Still here.
She is still here.
So finally, are there any specific calls to maybe who you think could intervene immediately, or is it a general call?
This is a general national call because of the disaster that we find ourselves in, okay? It's not one hospital or any one entity. All of those corporations that have CSR, okay, we're asking them to please reach out to the various hospitals, not just the John F. Kennedy Medical Center, to all of the different centers across Monrovia, even at Phoebe, to try to donate what they can because we are in immediate need for those things. You went in there, you saw each one of those patients will need to have gauze changes. You know, the bandage, those gauze wraps, sometimes it's $40 for just one roll. We're using multiple rolls per patient 2 to 3 times a day. If you do the math over the course of the next month to 2 months where you're going to continue to dress these patients, you then start to see the exponential need for these supplies. We need antibiotics, we need pain medication, pentazocine, we need analgesics like IV paracetamol. We're in dire need of those things. If you just imagine burning your finger and how it hurts, Then to imagine someone burned from the top of their head to the bottom of their feet. These people are in immense pain, excruciating pain.
Thank you. Your name again?
Dama Yekasin Kofa, Deputy CEO for Administration.
So we
to my
close up
left,
here with the clinician, you said?
Yeah, he is one of our consultant general surgeons,
Okay, so
Dr. Aaron Kokulu.
Welcome.
Thank you.
Your name, sir?
I'm Dr. Kokolo, consultant surgeon. The situation is very dire. I think I mentioned it yesterday. As she said, basically we had 29 patients and we have lost 30. And those 30 patients were very sick, basically. They are going to a point that we call hypovolemic shock, wherein basically because they have basically lost almost all of their fluids when they came in, and the kidneys had basically shut down, which is one of the complications of our best efforts in all that we did. Sadly, we lost them. But we think that we can do more, basically, if we have all the things we need. And as she said, time is essential. Because when it comes to burns, there's a time limit to be able to do certain things that you basically want to do. So we need these supplies as soon as possible. Most importantly, the IV fluids she talked about, the antibiotics she talked about. There's also a wake-up call in terms of our ICU, basically, because some of these patients need ICU care. There was a patient who basically came with the entire airway block because they make it as simple as I can. And we had to basically trick this patient, put a tube in, so that they can be able to breathe. And that patient needs what? ICU care. We would have enough space in the ICU. So those are things basically that we need to look at. Other things we need to look at also, we have something called pulse oximetry, that we monitor these patients' oxygen sats to make sure whether they need oxygen or not. We need more of these. So the bottom line here is, if we can have all these things that we need expediently, with respect to all that she has said, I think we can be able to save some. However, as I mentioned yesterday, out of the patients we have, almost 80 to 85% are critical patients.
So what are the degree of wounds sustained? So
the degree of wounds basically have what we call mixed burns. For example, a single person could have a second, third, and fourth degree burns at the different areas depending on how the fire went. But basically, in terms of the total body surface area, the least we have high is around 30-35%, which is very high. And all over the world, research that have shown that once your total body surface area is above 30-35%, your mortality rate in terms of death rate and prognosis is very bad, almost 80 to 85%. But be it as it may, with God's help, with the public intervention, with the support that we are receiving, we think we'll be able to save some. We have all these things that we basically need.
Thank you. Can we talk to one of the finally?
Dr. SW Logan. She's my third year resident. Okay. She's also been very active in trying to help these patients.
Okay, 1 minute. Welcome to the press. How are you doing, madam?
So thank you. Like you said, I'm Dr. SW Logan. So the need for these supplies, this is really a dark time for our country. Going in there, those patients, they are in dying need. Some of them are really fighting for their life. Like my consultant said, all over the world, burn of that nature having more than 40%, some have 50%, some have up to 82%. There's a young man in there, he's just 23 years old, but he has 85% burn already. So he's a patient of concern, and the need for them to be in the ICU cannot be overemphasized. But it's unfortunate that our ICU can only hold as much as maybe up to 4 or 5 patients, and not more than that. So it's like we have to make where they are, we have to make it an ICU. Meaning we have to have monitors outside. We need monitors outside for those ones that can be taken to the ICU. So if we do this, we could have a better outcome with our patients. But they are very, very critical, and we want to really say thanks to the JFK administration that since the 26th, we all have been on our feet. Nurses have not gone home, doctors have not gone home. We have been on our feet, depriving sleep so that these people can live, because they are Liberians and their survival is our priority.
Thank you so
much.
Thank
you again for coming to talk to us.
Thanks so folks, thanks for following us. My name is Prince, and with me, you want to say something finally?
Yeah, just some final words and pardon. We wanted to make sure that we express our condolences to the families that have lost their loved ones, that are also here fighting for the lives of their loved ones. It was a very emotional state here yesterday when we had so many family members coming to see the condition of their family, their loved ones here. We had a mother who told us she has 3 children that were involved in this fire. So our hearts go out to those in Bong County, in that particular district, to all of the families that have lost loved ones, as well as those who are fighting for their lives at this time. I just wanted to also express our sincere thanks and appreciation. Again, you know, sometimes we really don't speak much about some of the developments we've had here at the JFK. But this trauma center that you just went into has been was the brainchild of Madame Safua Maigret of NOCAL, under the leadership of His Excellency, Dr. George Manewia. And we're here at the Claire Marie Wea Center, the ICU and Trauma Center. And I wanted to say that because I think it's extremely important, like Dr. Logan just said, that we continue to expand these services across the country, not just at the JFK where we have the referral and tertiary hospital, right? We need to have ICUs across Liberia. Not everybody, every patient can make it out of, you know, Tapeta or out of Bong County or Grand Crew or wherever they may find themselves afflicted by whatever injury might occur to them. So we need to have ICUs across the country. So I'm praying that we continue to prioritize health in Liberia. Even if we can afford to fly, if you're not stabilized enough to be allowed, you know, to be put in a condition to fly out of here, you'll end up losing your life. So this should be a selfish endeavor for all of us. We should endeavor to make sure that we have better health facilities across Liberia so that we can all know that if we're involved in an accident or burn injury or anything of that nature tomorrow, we can all be safe. We have a distress call also for central lines. You know, all of these patients, based on the degree of burns they have, their peripheries, their arms, their legs, where we normally might be able to put IVs, peripheral IVs, we cannot put them there. Not only are those sites all compromised because the skin integrity is done, but we need to be able to get central lines in these patients because they need repeated doses of antibiotics, and they also, you know, we cannot access those areas. So we truly need central lines as well, in addition to all of the other supplies.
Thank you so much, so folks. Thanks for following us. My name is Prince Moba. The interview being carried by the State Radio, EFBC, Inquiries newspaper, and the GFK media team itself. Thanks for following us. Do join us another time. We're going to be here every other time to bring you updates from the GFK hospital and other hospitals across the country. The disaster management agency is also been here and be giving us update as to what unfolded on the 26th of December out of present. There are deaths. We just been told that the 29 patients brought to the GFK, they lost 3 already. So 3 has died, and those bodies are going to be transported to Bong County this morning. Thanks for following. Bye-bye.